Welcome to Public Health Matters, where we talk about what matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services here in the city of Nashua. Today we have a program about COPD, but before we get to that, I want to give you a little COVID update. You can see from the maps that we'll put up for you that COVID levels in the Northeast are at medium. Our community levels are very yellow, as you'll see in our corner, especially Maine, New Hampshire, Vermont, the state of New York. And so you'll see that levels are rising, mostly because I think we're going indoors more and there's more exposure to those germs. So be aware that if you are in a high-risk situation, as in a really crowded area with people you don't know and closed windows, good idea to throw on a mask. If we go to our next slide, we see our COVID community levels for New Hampshire. And you can see from October 20th to November 3rd, we have quite a big change in the state. We only have 2 counties that are green with low transmission levels. All the others are at medium risk. So again, take some precautions. Make sure you get your booster shot if possible. And on that note, we do have the bivalent booster that is available in most pharmacies. This booster protects against the Omicron strain and the original strain of COVID-19, and it is recommended 3 months after infection or your last booster vaccine. So those are readily available. We do recommend that if you are due for a booster, that you don't waste any time and get those, especially again as the weather gets colder. We're seeing more viruses in children, flu, COVID, all those things. Just a reminder that the monkeypox vaccine, the Jynneos vaccine, is available across the state. You can do a walk-in at Convenient MD, and at the Nashua Health Department, we also have the Jynneos vaccine for those that are uninsured or underinsured. So please reach out to monkeypox at dhhs.nh.gov if you have any specific questions, if you're at risk for monkeypox, or if you've been exposed to the virus. And now what we've all been waiting for is getting to our guest, Kelly Yellick. Welcome, Kelly.
Thank you. Thanks for having me.
And you are here to talk about COPD, chronic obstructive pulmonary disease.
Mm-hmm.
It is COPD Awareness Month, so
That's right.
I'm wearing orange. I don't often wear orange, but in honor of the month, for whatever reason, they have chosen orange as the color for COPD.
That's wonderful.
I'll never get it.
No, that's great.
It's a hard color to find in the right clothing.
Yes.
But Kelly, you're joining us from Southern New Hampshire.
Mm-hmm.
You are the program manager for the cardiopulmonary rehab.
Yep.
Over at Southern on Northwest Boulevard.
Yep, correct.
And tell us what you do there.
So what we do in cardiopulmonary rehab is work with patients who either have heart disease, they've had a recent myocardial or heart attack, or patients with pulmonary disease who have COPD, which is chronic obstructive pulmonary disease, and that encompasses a few different diagnoses. So it's a place where their physician would prescribe them to come and exercise with us, which you kind of think, wow, why would someone with a heart or lung condition come and exercise? But we like to say exercise is medicine.
Right.
It's one of the best things that you can do when you have a condition like that. So they are exercising in a supervised setting, so we can monitor that, number one, they're safe, and that hopefully we're able to improve the way that their lungs or heart are functioning.
So you have both cardiac and pulmonary
Yep.
in the same spot. And so we're not going to focus on those cardiac patients today because we're really here to talk about COPD.
Exactly.
And it's so important to have awareness of this disease. So I'll let you describe the 2 main things, because we hear COPD, like,
Yep.
What does that mean? When I was, growing up, emphysema.
Yep.
So tell us a little bit more.
Yeah, and I feel like it is one of those things that you've heard those terms before, right? Or maybe you've seen commercials on TV for different medications where they say, oh, the elephant on my chest, I have to take my COPD medicine. But what does that mean? So chronic obstructive means that, unfortunately, it's not a problem that's going to go away quickly. Chronic means you're going to have this condition. And a pulmonary disease, either bronchitis, which is what happens when our airways are inflamed, so they're swollen. So our airways that lead to our lungs are swollen, and they're producing extra mucus. So that is going to cause a cough, and a lot of times it's going to be uncomfortable and just feeling like you have mucus to get out of your chest, but it gets stuck there. So that's the bronchitis part. With the emphysema, like you said, that's a different kind of condition in the sense that from our major bronchi, we have our air sacs. So our alveoli are where our air is really exchanged in our lungs. And that's where they're damaged and people aren't able to get air in and out easily.
Okay.
So it's something like feeling like I can't take a nice, full, satisfying breath, or feeling like, oh, I just can't get the air out and I don't have room to get fresh air in, is more the emphysema, is just the damaged air sacs.
Okay, so it involves the whole kind of chest area.
Exactly.
It's two conditions, really. One of the bronchi
is that
bronchi.
major. Yep.
One
I
of
know,
the
all these
bronchi.
big terms that really mean it's hard to breathe,
Right.
is what it comes down to.
Right, so we have the bronchi and then we have the air sacs. And traditionally, like way back when, emphysema was, those little air sacs kind of popped and they looked like less bubbly, so to speak.
A deflated balloon, almost. It's not going to expand or contract as it should.
Yeah. So how do you get the official diagnosis of COPD?
So it has to be symptoms that have been going on for quite a while. So at least a few months of having a cough, shortness of breath that's occurring at times when it really shouldn't be. So it's normal to have shortness of breath if we're exercising or if we're doing something physical. But having excess or extra shortness of breath, just trying to do your normal activities of daily living, isn't really something that should be normal. So that's when you should kind of have a red flag. I have this cough. I feel like I've had mucus that I'm trying to cough out for a few weeks and it's not happening. And that's when it's a great idea to get in touch with a doctor, and then they would have to do an official diagnosis. But it's at least a couple of months of symptoms for even a couple of years.
Yeah, so you mentioned some of these symptoms, and I want to go back to that because to me that's really key. Is that, it's not normal to be out of breath if you have to go out to your mailbox and come back and you need to take a break. And a lot of people think it's, I'm just getting old.
Yep.
And that's very common among this population. And COPD tends to be a disease of the elderly. You're more likely to have COPD as you age. But that being said, it's not normal to not be able to get out of bed and go to the bathroom and come back. Being out of breath is just, when you said the red flag, the orange flag, whatever flag it is, really that is like one of the big things that people need to make note of.
It's not something that you should just be accepted that, this is just how it's going to be now. I'm going to have a hard time getting dressed in the morning or making a meal. I must be getting older. I'm just out of shape. COPD can be managed. So whether it's the emphysema or the bronchitis, and sometimes they overlap, they can be managed so that it doesn't have to have those effects on your daily life and your quality of life. So that's a good thing. If you have a symptom that you feel like it's been nagging at you and you thought, this was just a cold that's lingering, well, no harm in getting it checked out because there are things we can do about it.
Right. And so you mentioned the cough and shortness of breath we talked about, and also that doesn't go away after exercise.
Exactly. Yep.
Chest tightness was another one.
Yep.
Coughing up of mucus or phlegm for more than a month. You also mentioned that. Wheezing or noisy breathing, that, that coughing up blood. Of course, when that happens, you should always be contacting your physician or your provider. And unexplained chest pain was another one. So these are signs and symptoms, but also there's also risk factors for COPD. So that's really important to know because sometimes if you can combine, those symptoms with what's going on in your life, sometimes you really get a clearer picture.
Yes.
So one thing that I know is cigarette smoking. whether it's current or in the past.
Exactly.
I have an aunt who was just diagnosed with COPD. She quit smoking 40 years
Yeah.
ago.
And
And then they're like, why do I quit? But she's in her 90s, so she's doing okay.
Yeah,
So she still did the
absolutely.
right thing by quitting. But
Definitely.
that is one thing. If you were a current smoker or a former smoker and you're starting to have these symptoms,
Yep.
It's definitely something you want to get checked out.
Yeah, it's the number one risk factor, really.
Yeah.
Is that smoking, exactly like you said, either previous or current.
Yeah. And then you have something, biomass smoke exposure. Explain what that means.
So that's really just being exposed to smoke, whether it be secondhand smoke or also the air pollution, different things that you're exposed to, whether it be at work or in your home or just something in the environment that's causing you to be exposed and put your lungs at risk for becoming damaged from the exposure.
Yeah. So, and then occupational exposure. So, you of course, like coal mining, construction, concrete manufacturing, chemical exposure.
Yep.
And that's very interesting too, because even when COVID started, a lot of construction workers and different people already had those masks because they wanted to minimize that exposure, but we didn't always know that they needed to wear those. So it could be a prior occupation that is kind of rearing its ugly head right now.
Exactly, or something that years ago we didn't know, being in this factory with not a lot of ventilation, and maybe I get tired of wearing my mask all day, or maybe it wasn't even recommended, that the impact of that can have years later. So that's an unfortunate thing, is when you were exposed to something that you didn't even realize was going to damage your lungs.
Right. And then, of course, air pollution. I'm pretty fortunate here in Nashua. We don't have a lot of air pollution. And then there's these predisposing factors, which I always find interesting as a public health person, because some things you just can't help, so genetics.
Yep, genetics. If you have family members who have had COPD, it's a higher chance that you might as well. And being female.
And also, just peeking back to the genetics, there's a type of COPD, alpha-1,
Yes.
that really has nothing to do with the smoking or anything else. So I believe that that's a genetic
It is.
thing. So that families often, that runs in a family, if they have
Yes.
that alpha-1 gene.
And the good thing is now it's not a very invasive test. It's like a little finger prick to see if this is something that you're at risk for. And they'll do that a lot of times with that genetic factors. I used to work for a pulmonologist, and we would test family members of people who had COPD. And it's something that is a great way to screen early. And then have an awareness of, okay, if I'm at risk for this, what are some things I could be doing now to hopefully make that so if I am at risk for that I'm going to be able to have an easier time as I age, and make sure I don't smoke, because that would be a really bad match if I'm at risk for something, I have the genetic predisposition, and then I do something to damage my lungs.
Yeah, you can't win. And then low socioeconomic status. So that's just, looking at the data and seeing that those in the lower income levels are more predisposed. It's a greater risk factor.
And I think it's also sometimes, if we look at the environmental conditions people are living in, are they exposed to mold? Things like that, right, in their environment that they're growing up in. Those kind of risk factors, as well as not being able to get to the doctor and having chronic lung infections that were really never treated.
So before we move on to pulmonary rehab, because I do want to talk about that, because those are the things you can do to live with COPD and to live well with COPD. But there's this graphic that you had sent me prior, so thank you, which is pretty amazing. It's 24 million Americans have COPD, and half of them don't know it. So that just goes back to that early detection. Are you safe? 50% of lung function has been lost before most patients are diagnosed. So that's why we really want people to pay attention.
Yes. Like you said from the beginning, living with these symptoms that you really shouldn't be. Right. Saying, I can talk to a professional about this and feel better and live better.
Yep. And then COPD, we talked about, more common in women than men, 6.7% versus 5.2%. So not huge, but still more common. Let's see. But this is a good statistic. 70% of those with COPD are still in the workforce.
Exactly.
So that means they're still going to work and still functioning, and that's the hope that we want to give people by hearing this.
Yes.
And it is not a death sentence.
No.
It is, but it is very important to manage so
Absolutely.
that you can continue getting that mail without being out of breath.
That's right. Even if you think of the word chronic, meaning, oh gosh, this is going to be forever. Well, yes, but it might be to the point where I kind of forget that I have this because I'm doing so well and I'm managing it in a manner that it's not on my mind, affecting me every day.
Yeah. And then this is really interesting, that only 100 cigarettes smoked in your lifetime, which really is not, that's like 5 packs, puts you at risk for COPD. And 25% of the people, so I think I said 20%, but 25% have never smoked a cigarette. So that's that alpha-1 kind of, or that secondhand smoke,
the exposure,
or maybe the exposure. So interesting, but still tells us the importance of not smoking.
Absolutely.
And not starting, not trying or anything because of the people around you. And also, COPD is one thing, but then I always put this plug in, there's lung cancer and cardiac problems, which I'm sure you've seen also from former smokers that are going through the rehabilitation as well. So we always put a plug in for, there's a quit line, there's ways to quit, also to speak to your provider about that.
Absolutely. There's more and more resources, I feel now, and support.
Yeah. So pulmonary rehab is one of the biggest, most important things a COPD patient or someone who lives with COPD can do. And there's so many components to it, so I wanted to just break those down a little bit with you. So you mentioned the first, supervised exercise and education, small group.
Yes. And it's of like people. So these are people who their doctors are saying, okay, you have COPD, and maybe this person who's getting that diagnosis says, oh my gosh, I don't know anyone with that. What does that mean? Like, my spouse can't understand when I tell them I'm short of breath. How am I going to be able to do these things? So knowing that you're going to be exercising with professionals like nurses, exercise physiologists, dietitians around you to make sure you're safe, but that you're also going to be with other participants who have COPD. So that way, those people know exactly how it feels to be you and to trying to do those activities of daily living.
So right away, you bring up another thing. It's really a built-in support group.
Absolutely.
And I know that when I worked back in the day, would go visit Southern, not only would they go to pulmonary rehab, but afterwards they'd go get a cup of coffee. And they'd keep talking because you have a nice little cafe in there. But really important because also with COPD, you're having a harder time getting out. You have that social isolation. And we all know that that's not good for you. We've lived through that for the last year and a half, 2 years. So it really serves a bunch of purposes and getting people out, like you said, among like individuals.
And like you bring up with COVID, it was really scary for people with a chronic breathing condition like COPD to think, oh my gosh, if I got COVID, that would be a death sentence. I can't go anywhere, do anything. So being able to give them a safe place to come and feel like I'm able to do something about my condition in a manner that I'm going to be as low risk as possible as getting exposed around other people still. It was huge to these people. We had individuals who weren't going to the grocery store, hadn't seen family in months or maybe even a year, but they felt safe to come to pulmonary rehab, and it was really their only social outlet. And we were able to look at the way we take some pre and post measurements on how people are feeling both emotionally and physically, and just how it helped their quality of life. And their emotional health was huge. And that's when we said, wow, we have to make sure that we're always going to be here. So whether that means after someone graduates, because pulmonary rehab isn't forever. It's for 10 weeks is how we run our program right now. But then we have a monthly support group. So people can come and still get together. Or it's now on a Zoom platform. So they don't have to leave their house, but they can still connect with those other individuals.
Yeah, that's great. And so you kept going all through COVID, or did you close for a tiny bit?
We were shut down for a few months. For pulmonary rehab, it was about 6 months.
Oh, wow.
Yeah.
That's a long time.
That was, and just knowing that the patients that we knew were home, not able to get out, and all the ones that we knew that we hadn't been able to help yet. We hadn't taught them those breathing exercises or some stress relief coping mechanisms. We knew they were there and they were going to need our help. So luckily we have a good supportive leadership team to say, we got to get this program back.
Yeah, great. I'm so glad to hear that. And so we talked about education about the disease and about the
Exactly.
symptoms, medication. That's a really important one.
It is, and it can be really overwhelming if you think about any kind of medication, but especially pulmonary medications. There's so many, and there's always new ones coming out, and it can be even overwhelming to make sure that I'm taking my medications correctly, because inhalers
Right.
are not the easiest thing in the world to use, and they might look different, and there's discus delivery, and then there's inhaler, and then there's just a normal oral form.
Right.
So just understanding why I'm on certain ones.
And when to take them.
When to
because they
take
have
them.
what, I guess now they call it a maintenance, not a rescue inhaler
Sure,
anymore. So
yeah,
the
there's
language has
different-
changed.
just
But there are
different
different
kinds
like long-acting ones and short-acting ones. And it is a lot.
And if you're first getting a new medication at a physician's office, it's hard to take in all of that information and then go home and say, do I remember everything they told me about that? But I can't go back and ask my doctor tomorrow because I don't have an appointment for
Right.
maybe months from now. So being able to come to pulmonary rehab twice a week, and we have nurses right on staff to answer those questions, and to not only answer them, but to teach, well, this is why you're taking this medication, and this is the anatomy and physiology of what your lungs look like, and this is what this medication will do. And if you use a spacer when you take your inhaler, it will do even this much better.
Yeah.
And you just kind of see the light bulbs going off.
Yeah.
And that's when people say, oh, I don't like to take medication. Well, we might not like it, but
Yeah,
if we can
but you need to.
truly understand why
Yeah.
it's important and how it's going to help me, I'm a lot more likely to take that.
Yeah, absolutely. So we talked about breathing techniques. So that's important.
That's great because it's really just a simple technique that we can show someone. And if we have time, I can even show you quickly
Sure, go
a
ahead.
breathing technique that really makes a difference with anyone with a pulmonary condition. It's called pursed lip breathing, just what it sounds like. What we're going to do is breathe in for 2 seconds through our nose because our nasal passageways lead right into our lungs. We'll breathe through our nose for 2 seconds. Out through pursed lips for 4 seconds. Inhale for 2. Exhale for 4. So that's just the most efficient and effective way to get that oxygen into your lungs, but also to get the stale air out.
Okay.
Okay? Another great thing about that technique, it's a relaxation method. So anxiety and COPD unfortunately go hand in hand.
I'm sure, because if you're having trouble breathing, it's
That's
pretty
scary.
anxiety
Yeah,
provoking.
exactly. That's scary fast. It almost feels like I'm suffocating.
Right.
So that's a different level of anxiety than maybe having an ache or a pain that you feel like is kind of controlled. This is scary. So anxiety is very, very common in people with COPD. And sometimes that's not talked about enough. So patients might not want to tell us that they do have anxiety. So I think just being upfront and saying, it's totally normal to get scared
Right.
when you're short of breath. Anyone would. I would. But I can teach you a breathing technique that if you're starting to get short of breath, not only is that going to help you catch your breath, it's going to help you relax a little bit. And then that will make it even easier to breathe.
Yeah, so all these things are so important. So I'm going to skip ahead here to nutritional counseling, which, you know, diet is so important to so many chronic diseases. And I had learned a while ago, because I worked for Breathe New Hampshire, about, you know, the importance of nutrition and, you know, not having those high, even bubbly water, soda water.
Sure.
Because of the bubbles, they kind of like bloat you, and then that pushes up on your lungs. And so all of those kind of things are such great tips that you're not going to get unless you do this pulmonary rehab.
Absolutely, and it is just tips like that of making sure that I'm eating certain foods that aren't going to produce excess gas or bloating. And sometimes we're underweight if we have COPD. So how to sneak calories in without having like a large meal that's going to make me feel overfull.
Overfull and push on your
Exactly.
So let's see. So pulmonary rehab, I think it must decrease the need for checking into the hospital.
Absolutely. Reducing readmissions into the hospital is huge. And it's something that if we can teach people how to stay out of the hospital, it's great for them and just for their lung disease if they're not in that constant of that. Even though it's a chronic condition, we can have flares where it's worse, right? And then we have to go to the hospital and get treatment. That's going to take a lot out of your body and just your muscle recovery and stamina and conditioning. So if we can avoid that by just teaching you some tips and tools, it's going to make your life a lot easier.
And you teach people to recognize if they're going to have a flare, like you said, that there's like, you know, red, yellow, green, kind of how to recognize those symptoms, not to wait too long, when to call your doctor. So all of that management so that you don't get to the hospital.
Exactly. It's called a COPD action plan. So it's something that your doctor can kind of set up for you, and then we can see what it is in pulmonary rehab to say, okay, well, when I start to have an increased cough, I'm going to call the doctor, or they would like me to start this medication when I have excess mucus. So it's really just a great plan of action in that stoplight form of green means I'm feeling great. Yellow is the most important, meaning I'm just starting to feel a little different. So if I can catch this now, it's going to keep me out of that red zone going to the hospital.
And most COPD is managed in primary care. You don't necessarily have to have a lung specialist.
Absolutely.
So that being said, it's a call to your doctor. This is how I'm feeling. And they can prescribe, you know, based on talking to you or the nurse speaking to you and checking your symptoms. So I just want to leave our audience with some more resources. The COPD Foundation at copdfoundation.org. They have support groups. They have online things. They have amazing resources.
Yes, they really do.
They have the thing Lace Up for Your Lungs, which is, you know, get moving is what we're trying to say. The NHLBI, National Heart, Lung, and Blood Institute, also the NIH, National Institutes of Health. Learn More, Breathe Better, a whole program. If you go online under the NIH Learn More, Breathe Better program, there are all sorts of toolkits for caregivers and for patients and for, you know, questions to ask your doctor. So just really great resources out there. And then finally, in our own little state, we do have Breathe New Hampshire. They have COPD Connect, which is a resource, a meeting in November for whoever wants to go with COPD. They also have Team Orange to encourage, again, that movement. And they do that through the pulmonary rehabilitation programs. So Kelly, thank you so much for coming on the show. We really appreciate celebrating COPD Awareness Month and recognizing it, because it really is important, a very livable disease.
Exactly. So not something that we have to be ashamed about or try to hide, really just to understand that I'm going to feel better if I really just take it head on and talk about it with my physician and do the things that
they tell you to do.
They tell you to do that are really going to make your life easier.
Yeah. All right. So I do also want to recognize that it is Diabetes Awareness Month in November. So if your blood sugar over 100, know your numbers, know your diabetes risk. So again, talk to your doctor. We want to get people going back to their primary care physicians. A reminder that we want to crush that flu bug. A yearly flu vaccine is the first and most important step in controlling the flu virus. So please get your flu shot if you haven't already. And finally, we do have our clinic on Tuesdays and Fridays. We have lead testing and immunizations, and we have a sexual wellness clinic from 3 to 6 on Thursdays. Please call the clinic ahead of time for an appointment, 603-589-4500, and press option 2. And I wish you all a great and healthy week ahead. And remember, public health matters.